So we didn't make a conscious decision to try to get pregnant. It just was something that sort of happened.
We had like a 5-year plan. So like I literally got pregnant right at our 5-year anniversary.
Women with spinal cord injuries can get pregnant and do get pregnant.
Ask the doctor if they have any prior experience with anyone with a spinal cord injury or who was in a wheelchair or really any kind of mobility related disability.
Well, the formal assessment we recommend is really a good exam with your doctor, a review of your medication history, a review of your family medical history, because it's important for us to know what patients are taking, be that herbal, be that prescription, or be it over the counter. Somebody who has a heart problem might need to see the cardiologist before pregnancy. Somebody with terrible asthma may need to see their pulmonary doctor beforehand. The need for a maternal fetal medicine specialist depends on the patient's medical history and pregnancy history. You know, many spinal cord injury patients have no underlying health problems, but for the woman who's over 35 or over 40 or who has other underlying medical conditions like diabetes, they will need to see the maternal fetal medicine specialist.
Luckily, I do have 2 different kinds of wheelchairs. I have a manual wheelchair as well as a power wheelchair, and obviously the power wheelchair is really helpful when you start to get bigger and need to move, if you still need to move around quickly. But I was still able to move around and maneuver just fine in my manual wheelchairs too. Anytime I would need to go to the doctor and they would ask for a urine sample, I just used the bathroom normally, but made sure there was some sort of collection device or tool that they had, pour that into the collection cup, and give a urine sample as normal. A lot of times, I would just wear dresses so I didn't have to fool with extra clothes. When I went to the OBGYN, they would always ask for my weight and to visit a separate area of the hospital that had hospital beds where you can, transfer onto them and the actual bed weighs you.
They would weigh my husband first, and then they would weigh him holding me on the scale and then subtract his weight.
Spinal cord injury patients have no more risk for an early delivery than other women. So about 10% of women deliver prematurely, but that's the risk you have. And if you have twins, it's more likely. If you have other underlying medical conditions, it's more likely. The route of delivery is determined by the mom's medical condition and the baby's medical condition. We would prefer a vaginal delivery because the healing is faster for mom. There's less bleeding, there's less risk for infection.
So I didn't feel contractions in the way that maybe an able-bodied person might feel them. I actually was in a wedding the day that I started going into labor and was having all that back pain, and I had no idea. Didn't get back till, late that night after it was over. And then, kind of had that back pain all night, and again, just thought I'd had a long day and was tired. But actually the following morning, my water broke. At that point,
I kept having fake labor. I'd keep go to the hospital thinking this was it. And it was the classic, my water broke. It got tighter. It was just textbook perfect.
The contractions kept coming, and they told me you have the opportunity to take it now, and if not, then you won't be able to. So I went ahead and I took the epidural, and I didn't, it basically paralyzes everything, so you can't feel anything. So I didn't really feel when she was coming out.
The anesthesia for my SCI patients depends on their level of injury and what they feel. So for the patient who has pain, yes, an epidural is a great option for her. I have not seen more dysreflexia in patients with epidurals. When we use general anesthesia in a pregnant woman, we also put the baby to sleep at the same time. So we always try and avoid that.
At this point, I have a pretty good idea of the best way to kind of explain things to people and how things are going to work, and they usually luckily just trust that I know what I'm talking about.
I would recommend having an advocate at the delivery. We had an extra nurse come in, and my husband, he would hold my legs up too, and I was able to push and have a natural birth.
During the pushing phase, most women and their partner and the nurse are holding the legs back to push. Once we get closer to delivery, we do have stirrups.
You're gonna need to bring your medication with you and your own like personal self-care supplies. As far as my self-care goes, I kept my normal routine.
We rotate our patients so much in labor and delivery that they don't really spend much time to develop any pressure point issues. Have not seen dysreflexia be any more problem postpartum than it was for the patient before. So the same management that she usually does is what she can do now. We don't see an increased rate of episiotomy breakdown or infection in our spinal cord injury patients.
The unknown, it may be scary, but be positive as you can be, because if you don't have a good mental state, then good things won't come. So you have to stay positive.